All set, Lisa.
Great, thank you. Ready when you are, Dr. Shin.
Okay. Good afternoon and welcome to Let's Talk, a new offering by District 67. This is an occasional program offering intended to create time and space for constructive community conversation on timely topics. If you're joining us today, thank you for coming back and being patient with us last week. We did have some technical difficulties, so thank you to Dr. Bauer and Dr. Leali for joining us on Monday to share some timely and we think very beneficial information. This timely topic of vaccinations for our young kids is certainly very popular at this time, and as school districts, we are very encouraged by the availability of the COVID-19 vaccination for our youngest students, ages 5 to 11. This is another form of mitigation that will help us move past the pandemic, but understandably, many parents and guardians have concerns and questions about the vaccine. And so we are pleased to have an opportunity to address these questions today with an expert in pediatric medicine, Dr. Michael Bauer of Northwestern Medicine, Lake Forest Hospital. My co-host today is Lake Bluff District 65 Superintendent, Dr. Lisa Leali. We are partnering with District 65, the Village of Lake Bluff, and the City of Lake Forest on 2 upcoming vaccine clinics for any Lake Forest or Lake Bluff resident. We will share clinic details later in the webcast. On behalf of our district, I want to thank you, Dr. Leali, for your ongoing spirit of collaboration with our District 67 and District 115 teams. And with that, I'm going to turn it over to Dr. Leali, who will introduce our featured guest, Dr. Bauer. Dr. Leali.
Thank you. Good afternoon, everyone. We're so happy to be here. And if we have learned anything from this pandemic, it's that we're definitely better together. And so District 65 has been so grateful for the collaboration efforts among our 3 districts. Like Dr. Shin, I'm thrilled that the 5 to 11 vaccine is available for our students now and will be another layer of protection and risk mitigation that'll be available for us and our families. I'm also thrilled to have Dr. Michael Bauer here from Lake Forest Medicine to help us better understand this opportunity from a medical perspective. Dr. Bauer grew up in the Chicagoland area and earned his bachelor's degree from the University of Illinois. He joined Lake Forest Pediatrics in 1988 and is an assistant professor of pediatrics at Northwestern University Feinberg School of Medicine. Dr. Bauer is currently the medical director of Northwestern Lake Forest Hospital, where he previously served as the chief of pediatrics. He also teaches medical students and pediatrics residents at Ann and Robert H. Lurie Children's Hospital of Chicago. Dr. Bauer and his wife have 3 children and are the proud grandparents of 6 beautiful grandchildren. Dr. Bauer will begin with a few opening remarks, and then Dr. Shin and I will moderate the many thoughtful questions submitted by our communities. Dr. Bauer.
Well, good afternoon, everyone. Thank you, Dr. Shin and Leali, for having me here. As a pediatrician and somebody that's been caring for children in the area for 34 years now, it really is a privilege to be able to do this. And I hope you find this informational. You know, I know many of you parents rushed out to get the vaccine when it first became available for yourselves, but maybe feeling a little bit uneasy about what do I do for my children. And today we're going to be discussing predominantly the age range 5 to 11. And there's nothing wrong with that. There's nothing wrong with feeling apprehensive and having questions about this vaccine. The pandemic's been a time of great uncertainty and challenge for all of us. But we've learned a lot in this last year and a half or so. Thank goodness we're now at the point where we have a highly safe and effective vaccine that's proven to decrease transmission of the virus, decrease hospitalizations, and prevent deaths from COVID-19. And this is something really worth celebrating. Parents love their children more than anything and want to do what's best for them. And that really resonates with me, both as a pediatrician, as a parent, and a grandparent. Pediatricians have been following the COVID vaccine safety and efficacy trials and the vaccine rollout process since the very beginning. And we see our role kind of as trusted messengers who can provide this information to our families so parents can make the best decision possible for themselves and their child. I get the fear. I get the trepidation. We don't take that lightly, and we're here to address those concerns. But please make no mistake, and you'll probably hear me say this multiple times throughout this webinar. COVID is an illness that affects children. Children die from COVID. And again, I want to repeat that. Children die from COVID. It's unpredictable. Fortunately, we now have this vaccine that is safe, effective, and can help lead the way out of this pandemic. I really want to emphasize a choice to not vaccinate is not a risk-free choice. It's a choice to risk disease, which, and I think after listening to this, you'll hear science and statistics show that's a much more serious risk. So with that, I think we'll go ahead and get started, and I'll turn it back to Doctors Shin and Leali for the questions.
Great. Thank you, Dr. Bauer. We received many questions from the community and tried to cluster them together for topics that make sense. So I've got a couple to get started with Dr. Bauer. The first question is, why should my child get vaccinated?
Great question, which is really at kind of the root of all this. I'm going to try and not bore you with a lot of statistics throughout this, but please allow me to give you some that I think will really help get the message home. There have been almost 2 million cases of COVID in the age range 5 to 11 since we've been tracking in April. These now make up 15% of the weekly cases. When I started looking at these statistics about 3-4 weeks ago, that number was 10%. A year ago, it was 1/3 of that. What that's showing is this age range is now comprising a larger percentage of all the cases that we're seeing, more than the 12 to 17-year-olds who have likely had the benefit of the vaccination. The age range 18 to 49 now makes up almost 50% of all the cases that we're seeing. Nationwide, tragically, we are right on the doorstep of 700 pediatric deaths from COVID. There have been 94 of these in the age range 5 to 11. 5 to 11 children are at risk of serious illness from COVID. There have been over 8,300 hospitalizations, 1/3 of these in intensive care units. 1/3 of those hospitalized children had no underlying comorbid features or underlying risk factors. MIS-C, or multisystem inflammatory syndrome of children, there have been 2,300 cases in this age range, 5 to 11. They are the most vulnerable for this condition. There's also the potential for post-COVID complications. Once again, I can't emphasize enough, this virus, this illness is unpredictable in who it's going to affect and how it's going to affect them. And we really want to try and avoid these things. The FDA, the CDC, and the ACIP, or Advisory Committee on Immunization Practices, they look at all the data very carefully when making their recommendations. And while it's true, we don't know everything, both about this illness and about the vaccine. We certainly know enough from all these statistics and the vaccination that's been given now to over 400 million doses in our country. We now know enough to really support the findings that show vaccinating greatly outweighs any risk from the vaccine. The benefits greatly outweigh the risk. I can't emphasize that enough. It's safe, It's immunogenic, which means it provides protection. We have over 7 million doses given in the age range of 12 to 15 with no safety signals that were raised. And that includes in those that had prior infection. And I think the take-home message from there is we expect that same safety in our younger children. Statistics show that we are going to prevent in the age range 5 to 11 in vaccinated children 90% of the cases. This should translate to less post-COVID complications, less hospitalizations, less ICU admissions, and most importantly, less deaths. Because if you remember, I told you there have been 94 deaths in this age range. Hopefully, there will also be less cases of that MIS-C that I just spoke of. Additional benefits are increased school attendance, uninterrupted, not having to leave school, not having to shut down, less interruptions in your children's social schedules, in all their activities, less transmission to others in the household, including parents, grandparents, and others at risk. And perhaps one of the greatest benefits as well, if your child is now identified as a close contact, just like vaccinated adults, they will not have to quarantine and interrupt their daily activities. So I think when you look at all those things, it really sums up, this is why my child should get vaccinated.
Thank you, Dr. Bauer. As a follow-up to that, we get a lot of questions about the difference between the flu and COVID and the effectiveness of the vaccination. So hospitalization rates are comparable to pre-pandemic influenza rates for this age group, according to the CDC. If they're comparable, what is the benefit of vaccination, and how is that worth the risk of adverse effects, which you cannot quantify at this point?
I think that question serves as a great reminder why it's so important to get a flu vaccination as well. So I think what they're trying to say there is, while hospitalization rates may be very similar for a flu season versus those that get COVID, the mortality or death rate and long-term consequences are not. If you look at statistics from pre-pandemic, in the flu season shortly before COVID hit, there were approximately 38 million cases of flu in the United States, 22,000 deaths, okay? 38 million cases in that season, 22,000 deaths. Now let's look at COVID. We've had, I think, about 46 or 47 million cases, so a bit more, but 760,000 deaths, and that's in a 1.5 year period. That translates to approximately 30 times the death rate of COVID versus influenza. In a typical flu year, tragically, we see anywhere from 80 to 120 or 140 pediatric deaths. And I think you heard me mention that we're right on the cusp of hitting 700 deaths from COVID. So this clearly shows, while hospitalizations may be similar, the effects and ravages of COVID are not. We don't want anybody to get either disease, and that's why it's important to get vaccinated for both.
Dr. Bauer, we have a couple more questions about flu, and I think this is just hard for people maybe to try to compare the two. Now's the time you would normally get the flu shot for your children, and it's a lot, right, for little bodies and for parents to think about. So just really quickly, a question we've had is contagious. You know, which one is more contagious? Are kids more vulnerable to one over the other?
Okay. They're both contagious, that you can get both. But I think as we learn more and more about COVID, it actually seems to be a bit more contagious than flu is. And again, as we discuss, while hospitalization rates may be similar, the long-term effects tend to be much worse with COVID. Many of you that had COVID probably had loss of taste, of sense, of smell and taste. That's a neurologic issue. That's how this virus affects the nerves. You may lose a bit of your sense of smell with flu because you're congested and stuffy, but it's not affecting your nerves like that. So they're both contagious illnesses, but we really worry more about COVID than we do flu and the potential long-term effects and spread at this point.
Thank you for that. And just, this is really irrespective of underlying conditions. In other words, it still affects healthy children, correct? Who don't have
absolutely. As you heard me say, it's unpredictable. So while we know those may be at risk, so children with underlying conditions, those that are overweight, those that have diabetes, other lung or cardiac conditions may be at more risk. Unfortunately, healthy people as well get really affected by this. And there's just absolutely no way to predict that. Everybody should now consider this a vaccine, largely a vaccine preventable illness, just like all the other illnesses that we vaccinate for.
All right, I have a couple of questions related to the dosage of the vaccine and short and long-term side effects. So question is, the vaccine dosage the same for a 5-year-old as it is for an 11-year-old? That's a big difference in size, weight, and development. And also, how many 5 and 6-year-olds were tested with the vaccine dosage? Were there any adverse reactions?
Another very good question. So the dosing for this vaccine that's been approved under the UA, it's based on age, completely independent from size and weight. Many of you might be surprised to hear that your young children, your infants, starting at 6 months, when they get the flu vaccine, it's the same dose that you get as adults. When they get their DPT shots starting at 2 months, they actually get a higher dose than what we get as adults. And that's all based on how the immune system functions and responds to the vaccine that we're given. During the studies, they actually broke down the trials by age ranges of 5 to 6, 7 to 8, and 9 through 11. They actually started with giving the same dose in the Pfizer trial as adults, 30 micrograms, and then worked their way down. And what they found is that giving 10 micrograms, or 1/3 the dose, generated the same immune response that we saw in the adolescent age population. So that means we're able to give 1/3 the dose, irrespective of size and weight, to achieve those protective levels of the antibodies. Additionally, no long-term side effects or adverse events were noted. I do want to stress, we have a long history of giving vaccines, that starting with smallpox onward. And we know that any of those serious safety events, not the side effects, but the serious events, tend to occur very early on, usually within 2 weeks, typically no further than 6 weeks. That's why the studies go all the way out to 8 weeks. And fortunately, there have been some adverse events, and we'll talk about that more in relationship to myocarditis. But the benefits clearly outweigh the risks. So your young child is going to get 1/3 the dose of what we get, 2 doses, ideally separated by at least 21 days, because that's what the studies have been shown to be most beneficial.
Thank you. Is it true that data show that children are a much higher risk from the side effects of the vaccine than from COVID-19? And then if you wouldn't mind on touching on just myocarditis as part of this risk.
Sure.
Question.
Actually, it's quite the opposite, that they're much more at risk for the effects of getting COVID rather than any of the potential side effects. So let's look. The side effects of the vaccine in the trials were quite similar to what adults had, but really less so. Pain in your arm at the injection site briefly, anytime there's a needle put in there. Some children did get some fever, typically lower grade, headaches, some fatigue, and generally gone within 24 hours or so. What was really interesting is when they looked at the studies, about 10% or so of the children actually showed evidence of a prior COVID infection. And those children actually had less side effects of the vaccine than those that had not shown prior evidence. So again, similar to what the adults have had, but overall on a milder spectrum. Now, I think the second part of that question talked about myocarditis. So what is myocarditis? It's an inflammation in the myocardium or heart muscle. There's also been some very rare cases of pericarditis, which is kind of the outer surrounding sac or layer of that heart muscle. Let's look at what we know. Those rates of myocarditis from the vaccine are rare. They do happen. There's no question about it. Who's at highest risk? Males in the age range 15 to 29 with their second dose. It's on the rate of, in that age range, of about 1 in every 20,000 people getting the vaccine. We expect that we will see lower rates for the children 5 to 11, simply because we see lower rates of myocarditis in them, which you can get from any virus, not just the vaccine, but you can get that typically viral induced. It tends to be more of a post-puberty phenomenon, that the studies did not have any children that had myocarditis, but the studies were relatively small in comparison to the millions that will be getting this vaccine. I'm happy to report in Lake County, just this morning, the statistics showed that just about 10% of the children age 5 to 11 already received 1 dose. Nationwide, we've given over 1 million in this age range. And so far, there's been no adverse events or serious safety signals that have come up. So again, it's real, it happens, but it's rare. Now, what do we know what happens when you get COVID, or unfortunately MISC? The rates of myocarditis are much, much higher, and it tends to be much more severe than the rare cases of vaccine-induced myocarditis. In those cases, it's generally resolved within 2 weeks or so, usually treated with ibuprofen. Occasionally, other anti-inflammatories may be used. And so far, while it's a very real risk, it pales in comparison to the risk of getting myocarditis when you get COVID. And that's why I go back to the statement you heard me say earlier, that choosing to not vaccinate is not a risk-free choice. It's risking disease. And again, we've shown the benefits greatly outweigh these rare risks. An interesting study was done that I'd like to talk about, actually by one of our colleagues here at Northwestern, Dr. Micah Eimer participated. They looked at Big Ten athletes that were diagnosed with COVID, and they took about 1,600 were in the study. These were known COVID cases. they looked for evidence of myocarditis in them by doing cardiac MRIs. And what they found was a 2.5% rate. 1 out of every 45 had evidence of myocarditis. These were athletes, young adult athletes that developed COVID. So again, rare side effect of the vaccine that tends to be mild, or look at the rates of myocarditis that develop in our patients that get COVID. And that really, really resonates with me.
Okay, Dr. Bauer, a few questions in here about breakthrough infections. So we know we've seen that even fully vaccinated individuals can wind up with a case of COVID. And so knowing that the vaccine is really important for children who are at higher risk based on other conditions, do you still really recommend it, even though you could still wind up with a breakthrough infection? If you could talk a little bit about that.
Sure, absolutely. And I think that lends itself to one of the big topics that goes around now, getting boosters. Again, what do we know as this folds out in real time? The effects of the vaccine start to wane after about 6 months. And this data is largely coming from the adult population. We're starting to get it in adolescents as well. But we know that after 6 months or so, your level of protection starts to drop, depending which study you look at, by 3 or 4, perhaps even 5% or so each month. And therefore, we've been seeing some of these so-called breakthrough cases, or people getting COVID despite being fully vaccinated. What do we know about those cases? They largely tend to be either asymptomatic and are picked up because somebody was contact traced, or very mildly symptomatic. That the rates of hospitalization and deaths in breakthrough cases is dramatically lower than in those that were completely unvaccinated. They also tend to be in a bit more vulnerable population. So are we going to ultimately need booster cases, booster vaccinations for our children? We don't know that yet. But are we going to see breakthrough cases in our children? I would imagine after time, in a similar fashion, those levels of antibodies may start to wane. But in the short term, getting your child vaccinated is going to protect them. The other issue that often comes up in breakthrough cases, are they contagious? Certainly some people are, but many people have much lower levels of detectable virus and are not nearly as contagious. So again, the take-home message, and you've heard me say this, is we're still learning a lot in real time. There's no question there are breakthrough cases. They tend to be milder, result in many less hospitalizations. And for our children that we're just starting to vaccinate now, time will tell whether we need to boost them down the road or not. I would suspect that in the near future, we're going to see this become kind of like a yearly thing like flu. But again, we'll continue to collect all the data and find out as we go through this.
Okay, then really quickly, how about children who've had COVID? If they go ahead and get vaccinated after actually having it, should they expect to experience different side effects, more intense side effects, since their bodies have already started making the antibodies based on having that infection naturally?
Excellent question. So let's again look at what the recommendations are. And believe it or not, the recommendation for anyone that has COVID is get vaccinated. Why? We know the vaccines actually produce a better immune response because they're really targeting those neutralizing antibodies to the spike protein. So when you get COVID, you do develop immunity to it. But this vaccine is giving you the target to those most important antibodies and really setting up the defenses of our immune system. The recommendation is, if you've had COVID, as soon as your isolation period is over, that means day 11, as long as you're not having ongoing or new symptoms and you've had no fever for the last 72 hours, the recommendation is go ahead and get your vaccine. That I do think, and I would never discourage somebody from doing that. I think there are a lot of physicians, myself included, and this is opinion rather than fact, that would counsel people to say, you do have a bit of time. Your natural immunity is going to protect you for a while. And we typically look at about 90 days or so to say, you know what, it's okay to not get vaccinated for that 90 days, but make sure you do afterward. Because if you look, there's really only virtually no cases of new onset COVID within 90 days of somebody that had a recent infection. I think you also heard me talk about during the studies, approximately 10% showed antibodies to COVID. Those children actually had a bit lower side effect rate from the vaccine. So again, it shows you're not setting yourself up. You're just going to be amongst the best protected going forward of anyone.
Great. I have a couple of questions related to the timing of the vaccine. So the first question is, my son recently received the flu vaccination. How long do you recommend waiting for them to get the COVID vaccine? I don't want to overwhelm their immune system.
Okay. It is fine to co-administer vaccinations, meaning you can get your flu vaccine and your COVID vaccine at the same time. For that matter, you can get the COVID vaccine with any other vaccine at the same time. Many people are choosing to separate them for a bit, and that's okay, provided that you make sure you go ahead and get vaccinated. But for that specific question, not only can you get them again at the same time, you can get it the next day, the day after that, the day after that. When the vaccines first came out, many of the adults may have heard, boy, if you had an immunization within the previous 2 weeks, we didn't want to vaccinate you for COVID. That was still in the gathering all the information to make sure we weren't going to see difference in side effects, et cetera. Now that we've done, like I said, over these 400 million doses in our country, we know that it is safe and effective to give multiple vaccines at the same time. Most parents know when your children go to the doctor for their routine immunizations, they get multiples at the same time. And what we know is separating or delaying them does one thing and one thing only, and that's put you at risk for that illness till you get the vaccine.
Great, thank you. This is a question that we're certainly dealing with right now in our schools, but the parent asks, I'm planning to vaccinate my kids this week. There are several positive COVID cases in their homeroom classes right now. If they aren't exhibiting any symptoms, do they need to be tested for COVID before they receive the vaccine?
Excellent question. And for that, I would refer them to what has happened with the contact tracing that may have been going on. If you've not been notified that your child was potentially exposed, there's a difference between saying there's cases in my school, there's cases in my neighborhood, versus my child was identified as a close contact and having been exposed. If your child is a close contact, then they're going to be in their quarantine period, and we would not recommend vaccinating them till their quarantine period is over. During that time period, you certainly could choose to get them tested. That is a wise thing at approximately day 5 to 7, sooner if they actually develop any symptoms. But just because there's been cases in a school or in a neighborhood, if you're not identified as a contact at risk, it would be it would be fine to go ahead and get vaccinated. It never hurts to do the testing beforehand, but there's a difference between do we need to and is it okay to get tested?
One really quick question about testing, a different kind of testing. Would you recommend for parents to have their child screened by a cardiologist prior because of the myocarditis issue?
That if that's in reference to prior to getting vaccinated, no, there's absolutely no reason to undergo any type of cardiac evaluation or testing for myocarditis prior to vaccination. One of the things pediatricians know, there are algorithms and best practice now for children that have had COVID on clearing them for returning to sports. And we look at all those things based on their history, based on their symptoms, and based on their physical exam. We've had to refer a fair amount of children to go get some testing with either EKGs, echocardiograms, consultations with cardiologists for clearance to return to sports. Again, I will go back to that Big Ten study, which I find quite fascinating, at that 2.5% evidence rate of COVID in those athletes, of myocarditis in those athletes that had COVID. But no, there's no reason to do any type of testing cardiac-wise to look for myocarditis in an otherwise healthy child prior to vaccination.
Okay, thank you for that. And then also, I think we sometimes think of, vaccines for diseases like measles or polio, those being more childhood diseases, that we know those are standard immunizations that we want to have for our children. I think there's a feeling that COVID is not a childhood disease, that's something that is really impacting adults more than children, and differently than polio or measles and things like that. I don't know if you have anything that you'd like to talk about with regard to that.
Sure. So again, there's no question that the harmful effects of COVID are more common in the adult population, especially in the elderly and those with comorbid conditions. There's no question about that. But again, I think you heard me give all the statistics, and what we have seen, it still is a childhood illness. Fortunately, most children, the vast majority, are going to do just fine. But again, you heard me say it's unpredictable to the tune of almost 700 pediatric deaths, unpredictable to the tune of 1/3 of all the children hospitalized, no risk factors, healthy children with no underlying comorbid features. Look at all those that ended up in the intensive care unit. I was practicing at a time before the chickenpox vaccination. If you remember, that was thought to be a rite of passage, every child to get chickenpox. Parents would have chickenpox parties. They'd bring their child over to get exposed to go through the illness. Yet, we saw children die from chickenpox. The risk of getting a skin infection with a so-called flesh-eating strep bacteria, much, 20, 30 times higher in a child that had chickenpox. We developed a safe, effective vaccine. We say it's now time. Children should not have to go through having chickenpox and having those risks, albeit small, because you could never predict who was going to be the one to have such a severe case that they were going to have problems and potentially die from it. Now, COVID's very different than chickenpox. We never went through a pandemic, but the point is, it is a childhood illness. It is important to vaccinate them, both for their own health, as well as being able to reduce the spread and get closer to that so-called herd immunity, where we can get out of this being a pandemic now. The last point on that is, I think you see, especially for those who have children that have now gone off to college, et cetera, we see outbreaks of measles. We see outbreaks of mumps. Where do we tend to see those most? Well, we see it in pockets where they had not been vaccinated at all, or longer term immunity wearing off. It's not the too far in the past that we were giving MMR, measles, mumps, rubella shots to college individuals because there were outbreaks within their colleges. So again, the take home, make no mistake, kids get COVID, kids can suffer from COVID, and it can be largely preventable.
All right, let's just talk about the vaccine, and it's currently been approved for emergency use and still experimental. In fact, one of the CDC scientists stated that the effects of the vaccine on children could not be known until they were actually inoculated. He said, "That's just the way it is." Do you think it is important that parents, as opposed to the government, be allowed to make the vaccination decision for their child?
Boy, that's really a politically charged question. We do have quite a number of vaccines where states have mandated that these are required for children to attend school. And we're going to leave it to those authority figures to determine if it's going to be mandated versus just highly recommended. I personally think way too much was made by people looking at EUA or emergency use authorization versus full approval. I had lots of people that would say, well, I'm waiting for it to get fully approved. And when I would ask them, help me understand what's the difference between the two, the vast majority had no idea what the difference of an EUA versus having been granted a full biological license. We'll just touch on for a minute. The EUA program was actually established in response to 9/11 and the terrorist attacks. And it was to allow the government to authorize use of an unapproved product or a previously approved product with an unauthorized use, meaning, boy, this is a medication that's already been approved, but not for this use. And they developed that in response to allowing these when we have public health emergencies. And I think we can all agree that COVID certainly falls under a public health emergency. Generally, there's less data for something that's being given emergency use authorization. But make no mistake, those products, those vaccines, those drugs still go through the same rigorous testing process that all the products do, looking at safety, effectiveness, and manufacturing quality. To get the full approval, though, those companies must continue their trials, collecting their data to show ongoing safety and effectiveness. But make no mistake, the rigorous process to approve something is not sacrificed in any way, shape, or form. It was only due to modern science, modern technology, and the cooperation of the government with all the different pharmaceutical companies, both in the US and throughout the world, to get this vaccine into production as quickly as they did. So I don't think anyone should be deterred from getting the vaccine while it's under EUA versus full authorization. Remember, the Pfizer vaccine does have full approval now. It's just the age indication is still under EUA or emergency use for ages 5 through 15. They do have their full license for the older population. And we fully expect that as time goes on and they continue to collect this data, the same thing is going to happen, not only for the younger children, but for the other companies as well.
Thank you. I think this is a straightforward question that's probably implied, but maybe if you could just talk about the vaccination and how it protects the elderly or folks with serious health conditions, as well as our kids who are not able to be vaccinated at this point. They're under 5.
Part of our responsibility is protecting our children, right? This is what we're talking about. How can we best protect children under the age of 5 right now? And that's by getting anybody that's age 5 and older not at risk for having COVID. And how do we do that? By vaccinating them, right? That is the single best way. I can't tell you how many parents with newborns, all the grandparents and parents out there, you know how restricted you've been from seeing many newborns because parents have been so protective with that fear of a newborn baby getting COVID. Fortunately, we don't see very much of that at this age. And some of that is due to the moms getting vaccinated and passing on that immunity, and breastfeeding, which helps pass on that immunity to them. Who was the first to get vaccinated when this all started? It was the elderly, right? Those 65 and older, because we knew they were at highest risk. What we've also seen is they're the ones most vulnerable for the vaccine wearing off a bit early. And that's why those boosters were approved for them starting at 6 months. In the hospital, what are the breakthrough cases we see most? It's in the elderly. It's in those people that would probably be hospitalized with any type of infection because their underlying condition puts them at risk of being vulnerable for any consequences of any type of infection. So it's incumbent upon us to protect everyone we can, and that includes vaccinating anybody that's eligible to help protect those vulnerable, the elderly and the youngest that still can't get vaccinated.
So jumping off of that question, one came in live today. Is there any shown risk of future fertility issues after being vaccinated?
Yeah, great question. And I will tell you again, having practiced long enough to see many vaccines come into use that are not just completely routine, every time a vaccine is introduced, that question gets raised. We don't know. What about fertility issues? And fortunately, there have been no vaccines associated with any fertility issues. Now, one can say, well, we don't know. We don't know those long-term effects, right? Well, what happened when the polio vaccine came out? If people waited 20 years to see if they were going to be able to affect fertility rates or not, many of those people would have died from polio. And again, the history shows no effects whatsoever. From a scientific standpoint, there's absolutely no reason whatsoever to expect that this would affect fertility in any way, shape, or form. And as a matter of fact, human nature being what it is during the pandemic, people were still having babies. People were still getting pregnant. Women in studies of the vaccine that didn't know got pregnant. Fertility rates have not changed. Birth rates have not changed. Again, what do we know, though, about people that get COVID? They're the ones at risk for those downstream effects, even things that might potentially affect future fertility, just based on how the illness is affecting them. So again, zero risk. Every one of the major medical societies have come out with their position statements. This does not affect fertility at all. So, and again, that's just a common theme. I hate to use the term amongst anti-vaxxers. I'll prefer to say skeptics, but it's a common theme every time there's a new vaccine that comes out.
Thank you. Okay, so after I get my child vaccinated, will they be exempt from quarantining if they are exposed?
That as the guidelines now are, and hopefully they won't change, anyone that is fully vaccinated that then gets identified as a potential contact through contact tracing does not have to change their behavior. They don't have to miss school. They don't have to miss work. You go on about your business. You are supposed to stay masked. And of course, if you develop any symptoms, then you want to get removed from that situation. We do recommend that anybody that is a known contact, even if you are fully vaccinated, if it's been a close contact, we still recommend getting tested anywhere on the earliest side, day 3, upwards of day 7. But no, you get to stay in school. You get to go to after school activities. You get to go to your sports stuff, provided that you've remained symptom-free. And that's a huge benefit because let's face it, kids need to be in school. We all saw what happened this last year when kids weren't in school. And when they're not, parents have to be home. So there's that whole ripple downstream effect. Now, as far as when we may be able to get rid of masks, we're going to leave that in the hands of the public health officials when they deem that they're no longer necessary in the indoor school setting. What can we do to get there the fastest? That's getting everybody protected and vaccinated. That's the way to get there.
You just answered my next 2 questions, which were about masking and distancing and all of those other mitigations. So practically speaking, the best way to move us forward with reducing these reliance on the mitigations is to get as many people as possible vaccinated.
At 1,000%. I would be very surprised if those mitigation things get pulled back during this school year, because it is going to take us time to get up. We know masking is effective. We know the distancing of 3 feet or more is effective in schools. We've been able to keep schools open for the most part. Now getting vaccinated is going to get us that next big step. So hopefully going forward, we can get back to what we perceived as normal without having to do the masking and other distancing things.
Thank you for that. So as a reminder, we have 2 upcoming clinics that will be co-hosted by the Village of Lake Bluff, the City of Lake Forest, and School District 65 and 67. These clinics are open to all Lake Bluff, Lake Forest, and Knollwood students between the ages of 5 and 11, regardless of where they attend school. And they will happen in 2 different locations. Tomorrow, Lake Bluff Elementary School will host part 1 of a 2-dose clinic, Tuesday, the 16th of November from 3 to 7 p.m. And then folks who come to that clinic will be able to register for dose 2 on December 7th, and that will be booked before they leave. And then we have another set of clinics at the Lake Forest Schools Administrative Center at 300 South Waukegan Road in the boardroom. Dose 1 will take place Saturday, November 20th from 9 to 1 p.m., 9 a.m. to 1 p.m. And the second dose will be booked before leaving that clinic on December 11th.
Coming up quickly. Well, we're going to wrap up. First of all, I'd like to thank Dr. Bauer for his time and generous sharing of expertise today. I always learn something from listening to Dr. Bauer, and I want to echo something that Dr. Leali mentioned early on. We thank you and your medical experts for your collaboration and support of all of us in schools trying to navigate the science and keep kids in school. I'd also like to thank Dr. Leali again for her partnership on behalf of the students, staff, and family in our school district, and thank our audience for taking the time to join today or watch the recording at another time that will hopefully answer a lot of the questions you might have about the upcoming vaccination events. Today's presentation has been recorded and will be shared with our school communities and posted on the websites later this week. Thank you for joining us and have a great afternoon.
Thank you.